and good afternoon, everybody. Thank you so much for being here. Welcome to the November Men's National Community Health Worker Alliance meeting. My name is Mike Young. I'm the president, and I'm also the executive director for the Good Samaritan Clinic in the Midlands area of South Carolina. Um, welcome, welcome, welcome. How about we do an introduction, see who's in the room? Um, Tell us your name, your location. Um, what's something what's something that you've done this year to invest in your own health? And I'll start it off. Investing in my own health, I I've been doing more like self-care, things that matter, like that are more like not letting myself stress out. And I've noticed that that's really helped. Like not letting myself just get overwhelmed by things and even doing like these little essential oils, you know what I mean? Like they've been my backup and it's really I don't know, contributed to my sense of calm. And I feel like that's been paying off really well. Um okay, so we're gonna go one by one and just do introductions. And then also have some everybody share out what's something you've done this year to invest in your own health. Mark, your camera's on. Do you mind sharing going first?
Hello, everyone. My name is Martin Rivarola. I'm from right now in Santa Rosa, California. That's the San Francisco Bay Area. And the one thing I've done for myself health-wise this year, I found a really good sports medicine doctor that's going to help me in the years to come. Trying trying to get my left knee in particular to help me in the next at least 20 years. I got a lot of stairs in my house, and I my goal is to be able to go up and down on those. Thanks everyone for being here. I'll pass it on to Tyron.
Yes. Again, Tyron Wilson with South Carolina Cancer Alliance. Live right here in everybody know Myrtle Beach, South Carolina. So I'm real close to Myrtle Beach, South Carolina. One thing that I'm doing is just finding more me time. I mean, it's when you work so hard and you're doing so much for others, um, and you got to find that me time. And a lot of time, me time is just going and take myself to the movies. Just going to the beach or just going on a walk. Just remembering that if I don't take care of myself, um, I can't be around to help nobody else. So.
Thank you. And we're going to be hearing a lot more from him since he's going to be our guest co-facilitator today. Thanks so much for being here, Tyrone. Yeah, let's
Thank you.
kick it off. Let's go to Rebecca.
Hey guys, I'm Rebecca, CHW here in Columbia, South Carolina, covering everywhere. One thing I did for myself this year for my health was I actually listened to the doctors and did what was needed so I could beat cancer. So it's about as big as you can get right now.
Be strong. You're strong. You're awesome. Keep it up.
Thanks.
Great. Well, we have people coming in from all over the U.S. We're excited. This is exciting. We got California so far. I know Kyle's not in South Carolina, so tell us where you're at, Kyle. Tell us all about yourself.
Hey guys, well, it's been good to be back. So Kyle Saul, I'm in South Alabama, representing my company, 3415 Innovation Group. And then one of the things that I've done for myself and kind of help mental health is started a podcast called "What Matters Is Perspective" with a good friend from Michigan from back in high school. He's got stage 4 cancer, was given 3 weeks to 6 months to live. And so one of the things I wanted to do is kind of allow him to kind of document, his thoughts and his perspective on things. So when he is no longer here and not there for his children, they have something for it. And obviously it kind of twofold for myself as well. So Man, it's good to be back. Good to see you guys. Good to see some familiar names too. And Rebecca, thinking about you. I didn't know about your things going on, but definitely praying for you. Okay.
Thank you. Thanks. And this is definitely the place to share resources like that, especially if it's men's health related. Great shout out. I know Kyle invited me to be on his podcast, so I'm looking forward to that. But definitely everybody that has similar or related or relevant resources, share them and connect as well. Okay. I know Driarden's also from another part of the country. D, tell us about yourself.
Good morning, everyone. Well, afternoon, sorry. It is well into the afternoon. See where my mind's at. My apologies about my camera. But my name is Driarden Thayer. You can just call me D. I'm actually located in the great state of Delaware, as I like to call it, but I am a trainer for the Center for Community Health Alignment down in South Carolina in the Envision program. Um, one of the things I guess I'm doing just for self-care and health right now is I've started going back to the gym, um, which is a big thing for me. I used to go avidly when I was younger and haven't been in a while, but just trying to focus on my health. I always self-disclose I have hypertension. I'm one of those folks. So I'm trying to work on on this blood pressure. Been having some issues with that, but got my medication regulated and back in the gym. So that's just some of the things I am doing. So that's it about me.
Thank you. Thanks for sharing. Good to have you. And so for those of you that have just joined us, we are doing introductions, saying your name, where you're from, and then also what is something that you've done this year to invest in your own health. I'm gonna kick it to Natoya. Natoya, are you able to unmute? We'll come back to her. Steve Henry.
Hello, everyone.
Okay.
And I am Steve Henry, and I am from the great state of Michigan. I am from Detroit, and but I go back and forth between Detroit and Atlanta. But I'm right now in Detroit, and I work for MNCHWA, Michigan Community Health Worker Alliance, as I am the Workforce Development Coordinator, along with I do a lot of health and wellness things as well. And to answer your question, what have I done this year? I also have been working on my blood pressure. Only thing I have not been able to take away is my 21-year-old. That gives a lot of stress. So, but I do have. I started my own basement gym. And because I am in Detroit and we have some crazy winters. So I know I'm not going to want to go to the gym maybe when it starts snowing. And so I've really put in time to my own home gym. So that's some things that I've worked on this year.
Good goals. I like it. Kendall.
Good afternoon, Dr. Williams from Voorhees University. I am the Health Discovery Strategist for the Rural Community Development Initiative here. Things I'm doing currently is probably eating better, which I know I should be doing because I teach public health and as well as biology. But sometimes it's very difficult to do that, of course. And I'm also an aspiring community health worker. I'm working to get my certification under Mr. Thayer. Glad to see he's on here as well.
Excellent. Awesome. Thank you. Yeah, we're all connected. Um, Jackson, is that Jackson V?
Yes, good afternoon. My
Hi.
name is Vanessa Jackson, and I'm a community health navigator with CARE South Carolina, and we are located in the PD area. And what I did to invest in myself, going back to the gym, and we also participate in health and wellness events out in the community throughout the PD area. So I have to make sure I'm in shape before I can talk to others about being in shape and eating right. and glad to be here to see all you guys.
Thank you so much for being here, setting the example. I like it. Very cool. Part of the core team, Vernon. Vernon, you there? I know you're driving, but are you able to unmute?
Yeah, Mike, appreciate you. Good. Hey, glad to hear everybody, see everybody's there today. I'm Vernon Anderson down here in Ridgeway, South Carolina, about 25 minutes north of Columbia, South Carolina. Um, Work for D-Rate Group Consultant Specialist, specialize in working with PACE, program all-inclusive seniors with transportation, trying to keep those costs down, keep money in the program. Also a certified community healthcare worker. Um, Also in the core leadership with MNCHWA. And one of the things I did was also tried to get back in the gym. Drove past, quite a few times before I actually signed up. But we're in there now, so we're trying to make some progress, take it step by step.
Excellent. Good goals. These are all good goals, y'all. Natoya, are you there? Are you able to unmute? No problem. No problem. All right. We have Greg just joined us. Hey, Greg, how you doing? What we're doing is we're introducing ourselves, saying hello, our name, our location, our role, and what is something that we've done this past year to invest in our health.
Hey, what's up, everybody? Calling in, same thing, from Columbia, South Carolina. I'm the training manager here at the Center for Community Health Alignment. And I actually did a lot of focus on mental health this year and scheduled reoccurring therapy appointments intentionally and no matter what. So that's been a focus for me this year. I'm pretty proud of.
Excellent. Absolutely. Very important. All right. Last but not least, our guest co-facilitator today, Nicole Echols. You want to introduce yourself? And yeah, what is something you've been working on?
Nicole Echols. I live in Florence, South Carolina, but I always tell people out of a Honda Civic because I'm all over the state. I'm in Charleston right now, so don't pay attention to whoever walks by because they're just people who are staying at this hotel who get to hear me talk today. But what I did to take care of myself, which I did the day before yesterday, is book a flight to Barbados for 10 days. I'm going to go and relax and unplug and get off the grid for a few days and take some naps and eat some food and lay by the beach and let my tank be filled back up from all the things that I do all year long, which is a lot.
Awesome. Thank you so much for being here and being a guest facilitator with us for this session. Oh, we got a couple more people coming in. I seen Natoya join twice. I don't know. We got that mute things figured out. Maybe, maybe not. That's fine. Um, I saw one more join. Oh, Natoya's camera's on.
It's me again.
All right. You want to introduce yourself?
I'm Natoya. I'm a population health coordinator, community health worker for Carolina Health Centers in Greenwood, South Carolina. I guess one thing I've been doing for self-care, I was recently transplanted a year ago. So just more of my mental right now, trying to adjust with that. I've also started gardening to make my own fruits. I mean, produce my own fruits and vegetables to do some healthy eating for my kidney now. So just doing
Great.
some positive things for myself.
Absolutely. All that matters. That's good stuff. Kenneth, thanks for joining us. Want to introduce yourself and tell us what you've been doing and invest in your health this year?
Good afternoon. How's everyone doing today?
Great.
You can hear me? Okay. Well, I've just been making it a mission to my name is Kenneth Swearinger. I work at MUSC, with the Office of Community Outreach and Engagement. As far as my personal health, I've just been making it a goal to, eat healthier, diets, eat the correct portion size, as well as exercise regularly. I try to make it a goal of 3 to 4 times a week, as well as, drinking at least a gallon of water a day. So those are just some of the healthy practices I do.
Ambitious with a gallon of water. I like that. I need to add that to my repertoire. Very good. Awesome. Well, we have a good session scheduled for you guys today. Just an overview of MNCHWA, the Men's National Community Health Worker Alliance. Our mission is to strengthen the role of community health workers, CHWs, in improving men's health outcomes nationwide through education, collaboration, and advocacy. Our vision is a future where men's health is prioritized through trusted, culturally competent community leadership. Our structure as an organization, we have a national alliance. What we're trying to do is build on the associations in different states, and hopefully we can take topics that can inform the different associations and build a sort of curriculum, and maybe even develop a men's health focused curriculum that can contribute to credentializing and all the things to boost up community health workers around the country, and just have these meaningful conversations, bringing the vulnerability of men's voices to a platform where we feel comfortable sharing, and people can benefit by hearing our examples and our day-to-day routines, right? These little steps that we take, and celebrate those things. So yeah, we try and make these a very dialogue heavy meetings. So don't sit quiet, please. If something comes up, please raise your hand, and get the conversation going as well. So each month we bring in a special voice specialist that'll cover a particular topic. And today we are discussing cancer, and we have two special guests with us. You've already met Tyron Wilson. He's the community engagement specialist from the South Carolina Cancer Alliance. And we also have Nicole Echols, the chief executive officer for the South Carolina Cancer Alliance. So we're going to be talking about all sorts of ways of community engagement, cancer, health equity, awareness, those kinds of things. Are you all ready to kick off the presentation you might have handy? You're on mute, Tyron.
Yes, let me go ahead and share my screen. Let's see if I can make this work. Let's see, where are you? Okay, can everybody see my screen?
It might need you to double click. Okay. Yes.
Let me see. Can y'all see anything?
Yes, we do see it. It's not exactly a presentation.
Oh wait, I need to go to
that little guy right there. Start slideshow even at the top, maybe.
Yeah, man.
That works. That usually works.
Nope, I'm in the wrong place. As you can tell, I'm now slideshow.
Right, yeah.
Let's see. As you can tell, this is not something I do every day. So,
if need be, you can progress through the slides that way. It's large enough. I think.
See it?
Yeah, we can see it.
Okay. Nicole, you able to get on yet?
She's here.
Yep, I'm here.
Okay, so I'm gonna go ahead and you ready?
Yep, no, but I'm gonna be ready right now.
Hey, we're gonna tag team this.
Okay.
All
right. So for those who don't know, I am Nicole Echols. I am can y'all see me?
Yes.
Okay. CEO of South Carolina Cancer Alliance, and we just wanted to thank you for allowing us the opportunity to be here and share some of the work that we've done. We work with the 5 screenable cancers, and we provide advocacy information across the state of South Carolina. We work with breast cancer, colorectal cancer, prostate, lung, and what was that one? Surprisingly, I missed one. I always miss one.
Colorectal.
I said colorectal. But so we work with the 5 screenable cancers, and I don't know why I talk about them all of the time. I was today at Roper talking about lung cancer and screenings, but we really promote early detection. We have a small but mighty team that goes across the state that does multiple initiatives to make sure that this work is seen and heard. And so the purpose for today is kind of talk to you about the South Carolina Cancer Alliance, what we do, how we do it, and one of the programs that we worked really hard on in the last year to really increase the awareness and education along with the screenings of prostate cancer. So the purpose of the alliance is really to reduce the impact of cancer among all South Carolinians. And we really work hard to make sure that is done. But one of our main focus this year has been focused on getting into the areas that African American men are and providing education and providing screening. And we'll talk a little bit more about that as we progress. But that's what we're here to do today, just to tell you about some of the work that we've done and some of the grassroots outreach that we've participated in to make sure all of that can happen and success. So, Tyron, you can go to the next slide. So we see that these are the areas that are in the heavily green shaded area. We work with DPH to the data registry to figure out the areas that have the highest mortality rates and the incidence rates. We've kind of worked on the incidence rates, but we also know as we continue to do this work, we get out into the community, we get people screened, we get people educated, then the incidence rates are going to change because we're doing that work. So we're now really focused on the mortality rates and finding early detection and making sure that men know their prostate PSA number and what that looks like, making sure that we're linking them to a medical home. A lot of you on this call, some of you, Care South in particular, we refer to make sure that people have treatment and care after, and knowing that if they are in care, that they're to have conversations with the provider and understand why it's important to have providers that make sure you're listened to and heard and understand that the relationship between you and your provider is so important to your health, to make sure that when you're there, you have an opportunity to feel comfortable, seen, heard, and asked questions about your health. So you can see that the rates of the parts of the state that we see are upper Midlands, low country, I guess, the way the state's divided. And I spent a lot of time going across the state. I just asked my one of my colleagues to pull my numbers of how many miles I've done this in the last 6 months. And she told me today that it was 7,000 miles that I have done from July till now. And I have covered most of these areas in the state, and most of it in particular in the areas that are green, to build those relationships and talk to, and mainly community health workers, because I mean, that is the best and most effective way to get into the community and sit at the tables and in the spaces where people in the community love and live and trust. And so that's what we do. So we see that with those outcomes are staggering to us, and especially since nationally, we, of course, and the things that we should not rank the worst. I always say to people, thank goodness for Mississippi and Alabama, because that's the only thing that prevents us from hitting the ground. But at the end of the day, these are things that we can change. We can have conversations. We can change the outcome. We can change your survival rate. And we know that if you're screened, your percentage of ability to beat this and remain and be healthy and have a healthy life is around 75-80%. So we know that if we can detect these cancers early, and all of the ones that we are screening, we know it can save lives. Next screen. So this is where I'm going to kick it over to Tyron, because you see all this amazing work that has been done. This is our impact report of what we did last year in a short amount of time. One of the things that when I started at this role at the South Carolina Cancer Alliance, that there wasn't a man that represented, or anyone who represented the demographic of people that we wanted to serve. So I took time to really work through and find people that were in the community that the community already trusts. And of course, community health workers. Kelvin is in the other part of the state. Tyrone came on, and a lot of this work was done by hitting the pavement, finding out where men were congregating, finding out where the trust was, and some of the faith-based communities, some of the fraternities, the Masons, the bike clubs, all the places that people already were and were having conversations, but they weren't as open to have a conversation with me, but they were open to have a conversation with, Tyrone and some of the providers that we have. And so we decided to really make a different approach. And so Tyron is going to tell you a little bit about what some of the work that he did in ways. You can hit the little start slide. It didn't make a difference when you hit that up at the top. Oh, well, there you go. So Tyron, we can go back to the impact report and talk a little bit about how all of this work really happened. We can't hear you, Tyrone. Are you still on mute? Can y'all hear him?
No, he's on mute.
Yeah, there you go. Are you still on mute? Where'd he go? Is he talking?
I think he's trying to find the unmute button.
Okay. Well, I can continue while he works on that. But we used the data, and that's how we drove some of the places that we decided to go and build relationships. Some of the most fruitful ones were the motorcycle groups that we worked with in Orangeburg, or some of the fraternities. One of the largest ones is the Masonic Temple. We found that most of the men that were in these groups were 45 plus. Some of them have not had conversations about prostate health, didn't know what screening was, thought the digital exam was still a thing, and it's a thing of the past.
Right.
That a simple blood test could really make a difference and have you understand. Are you there, Tyrone?
Yeah. Can you hear me now?
Yeah, we can hear you now.
Yeah.
So go ahead.
Go ahead. Now go ahead and finish your what you were saying.
Oh no, so I was just saying that the success in getting over to reaching out to over 3,400 and something men, and also providing that screening tool and screening for doing the blood test was instrumental by Tyrone and Kelvin. So you can continue to share.
Right, and again, we know that we needed to. We know the areas that where the green was pretty hard with, so we went into a deep down into the communities to make sure that we go face to face. We work with a lot of different churches, different organizations, boots on the ground. So as you can see on the side with the different counties in South Carolina, that we was able to set up a lot of free prostate cancer screening through blood tests. Because again, a lot of us don't know that there is a simple, procedure as through blood tests with the PSA. So again, I didn't know that until I started with South Carolina Cancer Alliance. So as you can see, we went deep into the areas and just make sure that, and we work with, for example, with Masonic Lodge, but we also work with Sons of Allen. Again, our goal was to go where they are and to educate and inform, and the numbers speak for itself within that short period of time.
Next slide. So these are our illustrious team of men who have, we have Vince. He is the one who is we brought on board to actually do the screening. So he has a team of himself and a few other phlebotomists that while we're out in the community, like for example, this was it past Saturday, we had over 300 men in Columbia at an event. We had over 43 men screened. We had 17 go through the MUSC SCMAmen program all at the same time. And we worked with Trinity Educational Center. Representative Cremati, Bishop Redfern, and a few city men on the wall to really have an event that brought education, information, gave room for additional real training with the SCA Men project, and then also allowed us to screen and really defy some of the myths of what prostate cancer is like, and talk about different ways to take care of yourself and ways that if you have urination and it's frequent, or there isn't really a true signs and symptoms because they mimic other things, but just emphasizing the ability to have a conversation and share and trust. What is something? Oh, you have a question?
Yeah, I figured while you're talking about this really impressive event with all those men, what would you say is something that you would attribute to the success of that? Like you got such a high turnout. What do you think you did that led to that?
Oh, absolutely, without a doubt, partnerships and collaboration. I mean, I I am a proponent of working together. If it wasn't for the fact that the South Carolina Cancer Alliance, along with Trinity, Men on the Wall, it's maybe 5 or 6 arms of different people pulling together to make sure. We invited men. We did some radio shows. We did some TV shows. We got out into the community. We really were intentional about making sure that it was game changer, I think was the name of it, and getting out there and sharing and having men understand how important. And of course, we threw in a gift card if you guys screened, so that didn't hurt either. Yeah. Right, and you'd be surprised. And actually, after the gift card even might draw them there, but a lot of times when we start screening, they don't even care about the gift card anymore. They're happy to be there, happy to take charge of their health. And we only give away the first few people gift cards anyway, and the rest, they still get screened and they still stay. So it's an incentive, and it does help motivate people maybe to get out of bed, because it started at 9 a.m. on a Saturday, which I was kind of leery about because that is very, very early. But I would say if it wasn't for us, having multiple meetings, having a plan, having committees, having work groups, and working across all the different organizations, nonprofits, faith-based communities to really, to mobilize us to make it happen, it would not have happened. It took really strong partnerships and collaboration for us to have that amount of success, to have over 200 men sitting there in a room listening to our panel. We talked about mental health, we talked about prostate health, colorectal health, and just overall taking care of your body and making sure you're doing what you need to do to stay healthy, because we want you alive.
And one thing I want to add to that is as we ran out of gift card, because again we only did the first 20. Really, a lot of guys didn't even care about the gift card, because again they was in that space and they wanted to make sure that they got help. Got the PSA screening so they can know their number. Because again, if you work together and you get them there, and how you get them there, they'll take advantage of every opportunity that you have. So again, it was a great success for us. Great success because we also, when we did this event over the weekend, we partnered with SCA Men. South Carolina. South Carolina Amen program. And again, this is a session where they speak about prostate cancer, and they gave each one of the participant a $50 gift card for being there for an hour and a half, and they had no problem with it, because again, as we also partnership with it's called Shield. Shield does the colorectal cancer screening, through blood tests. Again, you'll be surprised. Many men was stuck twice because again, everything was in that one space and they took full advantage of it.
Yes. So, and just for reference, I know that we throw around the word PSA like for us, it's a common word, but it's the prostate specific antigen test. It's a blood test that measures the amount of protein made in the prostate gland. So just for reference, because we always want people to know their number and understand what that is, and understand that that is a blood test. And you hear us reference it quite a bit, but I just wanted to clarify, because a lot of times
we'll talk about it, and when you're in your own lane, just like we say CHWs all the time, and people are like, what's a C? We'll say community health worker and give a little bit more background, but just for reference, what that PSA actually stands for.
Yeah, and can I extend that so obviously this is a specialized area that sometimes we might not feel equipped in bringing up or so like in your opinion, and this is open to the other CHWs in the room too, like what do you think you need? What do CHWs need to feel equipped to talk about prostate and colorectal cancer, right? Um, from both
Yeah.
ends, from yours and then the room too.
I would say we have a lot of tools on our website, but American Cancer Society has the best. They have a lot. Prostate Zero has a lot of resources. We utilize a lot of resources on there. I would say that there's some training modules that would be beneficial for community health workers. There's even some programs that are there's also modules just dedicated to community health workers and cancer research and education. So there's some of that out there. Shield, one of the colorectal companies, and Exact Science has even some modules that are for community engagement, and that you can go and get those resources. You can print that material. You can share. Those are the main things. I also see with the PSA, it depends on, we try not to say what number you need because there's a lot of underlying factors in what it is. We recommend 45, 40-ish loosely plus for you to get screened. And then we also recommend for you to know, but knowing the number is almost like your blood sugar. It is really pertinent to you and your care and what's going on with you. We know that 4+-ish is a little bit on the abnormal side. And when you get to the 10s and 11s, that could be out of range, but it's based on your family history, your medical history, your age. There's a lot of underlying factors. What is normal to you might not be normal to someone else. Just like if you're a diabetic and you ate dinner, that normal number might be different. If you have A1C and you have diabetes and you don't, that number looks different to you. So we try not to give an actual number of what is the best, but we also say that we want to keep it lower than higher, of course, but we
And
don't
Nicole,
want. Yes.
Nicole, and let me also add that the goal in with us doing the test is for make sure that they find a primary doctor. Because again, we want them to find a home. So again, with us doing the testing, the goal is for them to find a primary home, find their primary doctor.
Yeah. So we want you to know we provide you with what it is, and then we ask if you have a medical home. And if you don't, we work to try to fit you in with a free medical clinic, a FQHC, or to send your results to your actual provider. So we just want to be the first line of defense so and you are educated and you take that screening and you have it. But we are just the first and the tip of the iceberg of what we want of the holistic approach of making sure that people have care. We really don't want you to get screened with us again. We want you to feel so confident and so comfortable that you continue to have conversations with your provider. And every time you need to get screened again, you'll bring that up and you want to know what it is and you own your own health. So that's just another thing. These are some of the events that we've had across the state, from Orangeburg to Anderson to Bamberg to Columbia to Florence, all over this big old state of South Carolina. We have brought this information and education all out, and these are just a few of the pictures of some of the work that we've done. I think we were around 3,000 some odd, and these are some of the plans and the goals that we wanted to identify the places that that had the highest rates. We want to identify areas of most need. Let's see. And we want to make sure that these are some of the things that we had charted out when we first got some of this funding to go ahead and do it. Go ahead, Tyrone, while you do that, I'm going to look through the chat and try to answer those questions.
Okay, yeah. And again, the community outreach engagement, these are, as you can see, we exceeded our goals. Because again, we all about organizing communities event. Again, we feel like if we did 4 of them within the year, and also with building partnership which is major, by connecting, as you see, over at least over 100 from 120 to 150 people. And again, education and awareness, develop educational materials. But at the end of the day, as you see the plan, these are things that what we're doing so we can make sure that we're going into the communities, making sure that we work with partnership, and we are also tracking in what we do, and sustainability, to making sure that we be around. So again, just to add in there, just to throw in there, we do take donations, as in the work that we do. Because again, we want to partner with you. We want to be able to give incentives to different folks to get them to come through the door. So, and we did a great job within the year. So we continue to make a difference with the people in the rural, and especially the rural community where they can't, don't have transportation, or don't have ways of getting there.
I see in the chat, is prostatectomy still a thing? And what does it say? I can't read. Does it? I think, well, it is still a thing. I am not a medical doctor. I'm just here for the awareness and education and sharing and prevention, early detection. So I would say that it is a thing, but I think it's something that you and your provider need to discuss if that's the best thing for you. Sometimes it does work, taking out the gland is something that's best for you, and some people don't. So it's all in what is best for your care. There's a lot of new treatments. There's some invasive treatments. There are some, when I was at a training recently, there's some things that they're trying to do that are like sonic hair. I mean, there's a lot of things that are out there moving. Even today, in the space I was in at Roper, they have a robotic arm that pretty much does the surgery for you, and you can feel and touch. There's a lot of technology going into this. But my thing is always going back to your provider and talking to them and making sure that they talk to you about what's the best treatment and care for you. Go ahead, next slide. And so in those, and I don't know if you can see them, but we ask questions. We have evaluation tools. We want to know if you have a medical home. When is the last time you saw a provider? Do you know, are you comfortable? We want to make sure that we do an appropriate referral and gather the information from the people. We're in places that some of our counterparts, some of our FQHCs, because they are just defined by different geographical areas, or they can't go into another county, or one county does something more than the other. We really try to capture all the data that we possibly can so we can report our impact and what it means. And then we can make appropriate referrals to where you need to be and what care looks like for you. Go ahead. You want to talk about that, Tyron?
Okay, we're going to talk about our current work plan for 25-26. Increase awareness and education for men's cancer through evidence-based and prevention. Again, the goal right there is simply to make sure that we go out in the community, making sure that we are working, partnering with, strengthening partnership with one thing that we're doing that we're working on is called a Men United Health Initiative. And that's where we're trying to work with different organizations, different groups. For 1 year, we're doing we call it what is it called? A mini grant. We're doing a mini grant of 10 organizational groups that we're going to be working with them hand in hand and going through talking about lung cancer, prostate, and the colorectal cancer through the whole year. So that is one program that we're doing, that we're trying to, especially with the prostate cancer, and community outreach and engagement. As you can see, I don't know if you can see on the bottom, I've just been talking about the men's initiative, but also with the annual PSA screening events. We did a lot over the year. And again, we're planning on doing much more. But again, Nicole, I'm talking about this again. It takes fundings to do what we do. So again, I stress that because, again, we go into the rural areas. We go into the areas that that they don't have that transportation. But the most important thing that we do is we partnership with a lot of folks to make sure that we reach those folks that need these tests.
Yeah. So, and as an organization, we do receive some state and federal funds, but of course, we all need more money. I mean, I think that's not something that's privy just to us. But at the end of the day, I mean, we are really intentional about being good stewards of our dollars and using it. Similar projects, yes, we are happening. Yes, in other states and in our state too. There's we get in and we partner where we could fit in. So like Roper is an example, Care South is an example. They do the prostate screening example. So we don't have to. We just go where the places that there isn't anyone to do it, then we'll provide it. But we go in, so, and what is Spartanburg Regional, they do it, and we'll provide our expertise and research. And we'll go out in the community, we'll pass out flyers, we'll help people come to the event, even if we're not screening. At the end of the day, we want to make sure that if we do it or our partner does it, it doesn't matter. We want to make sure that the whole circle is complete and that we are educating, providing information, screening, and making sure our people have a medical home and also feel confident. Other states across are doing the same thing. South Carolina has just put a little bit of emphasis around it because our mortality rates are staggering when it comes to other states. But it's because of the detection. It's a lot of late stage diagnosis, and the treatment and all of those things are harder to provide care when they're finding out later on in life. So they have to be a little more aggressive. So that's why, as an organization, we stress early detection of all our screenable cancers because they save lives. But for South Carolina, we really are working tirelessly, and we all want to make sure this is all done. And so there's a lot of different people working together to make sure that this is in play, that we really provide education, early detection, and prostate screening. And if it's not us, we will partner with whoever is doing it to make sure that we meet the community needs.
And one thing, over the weekend, and this is ongoing, that we partner with, again, SC Amen program sessions. So again, that is something major where men can find out more about their body and dealing with the prostate. So we that's one of our biggest partnership that we have done within the last few weeks. So we're glad to have them aboard.
Yes. Is there any other questions or some example? Yeah, I can't see. So when I get close to the screen, some examples of outreach approaches.
Culturally responsive.
Go ahead. Say the question.
Yeah, and just responding to the culturally tailored, right? So like thinking of any of that nuance that maybe a community health worker might be able to learn from, or even share out that works for them, that you've seen work for different populations.
Yeah. Well, I always say that if you want to speak to the population, you have people that the population trusts. And a lot of time that trust lays in the fact that they look or feel or live like the community that they're engaged in. And I think we are sensitive to that fact that wherever we are people, we honor and love people who are all different and show up in the way and they do. And we want to make sure that we adhere to that. So we have, like, say, Valerie Diaz is on our team, and she's going to work with breast cancer space, and she is going to do an entire event in Spanish, and she's going to reach out to all the people that the community trusts, the providers that are going to do their presentations in Spanish as well, and making sure that that is relevant, making sure that it's culturally competent. We take our time to make sure that we do our due diligence in doing that. What do you say? So are some of the examples of how we do that is going out there. That's why I have 7,000 miles on my car, is because I want to.
You can only imagine how many I got.
No, I don't even want to know. I don't even want to know. If I'm 7, you're probably 14. But it's going to where people are, being where they are, and talking and building and establishing trust. and not going in to tell people what they want and what they need, but taking ear and listening and making sure that people feel seen and heard. And if going in wherever, Winsboro, and I don't even know, Choppy, I'm all over the place, that, and finding someone who kind of holds your hands and guides you through the community and understanding the nuances and be open to the fact that each community is different. Like, I live in the PD, and the way Florence operates is a different country in the way that Darlington operates, which is a completely universe in the way Hartsville operates, right? They are adjacent communities. They are all within the next neighboring counties, but they function and operate different. If I'm in Timmonsville, South Carolina, I'm going to talk to the people in Timmonsville, South Carolina, that the people in the community trust. I'm not going to come and say, hey, here I am. This is what I do here. I go and I listen and I hear and I figure out who they trust, and I go and I'm seeing and I'm sitting next to them, eating dinner, talking to people and figuring out, and then adding them, putting someone who works for the Alliance in contact with them so they can continue to follow up and do the work and share. And that is how I really truly believe that we have been successful in that, because we take the time to listen. What is it? Do primary care physicians request? They can. We can, if there's not, the test should be. You can. We advocate for you, if you're 40 plus, to ask. Some people say, oh, not now, not demand.
Yes.
This is your body, this is your care, this is what you need. If your doctor says no, the simple question is, why not? ACS says this. These organization, Prostate Zero says this. This is what I like. I mean, if you're doing all the rest of the labs, add this one to it. You should have that conversation with your provider. We'll start you off with the education, and we'll start you off with a baseline. So you're even just going and asking to be retested again and to be monitored. And if they want to send you to a urologist for further screening, then that's what they do. We also try to link you up with resources and people who can pay for that urologist visit afterwards. So we want to make sure that your physician knows and continues to, but you have to be the one to advocate for your health.
And Nicole, I want to add, because again, the many men, we work hard and we forget to take care of ourselves. So whenever I go and speak to different churches, different organizations, I stress that to the men, but I also stress that to the ladies as well, because they have sons and nephews and and uncles, again, because again, well, if we go to the earlier you go to the doctor to get detected, to get the PSA test done and get detected, the better chance you got to be around. Because again, that's one thing that we make sure. We just want you to be around. Get tested, whether with prostate or whether it's with breast or colorectal, or whether it's cervical for the young people, the lung cancer. Again, we just want you to go to the doctor and find you a primary doctor and make sure that you get to know your doctor. If I feel like I tell many, if you can't hold a conversation with your doctor, your life is in his hand. So if you can't ask him if, who's his football team, or he can't ask you that question, you might need to change doctor. That is my opinion.
Yeah. And with that being said, there's two folds. Toya, I heard your question. I'll get to that. But also, as community health workers, you're sitting in the table, you're sitting in the spaces, and you're sitting with and holding the trust of the community. So you sometimes can be the advocate that they don't necessarily have. You can speak on behalf. You're talking about their care. You're talking about their well-being. So I would definitely say, as community health workers, you are the liaison between the hospital systems, FQHCs, free medical clinics, and the patient. That is your thing, is the connector and convener. So if that's an issue that you see, that the patients that you have that have a need, be the voice and be the advocate. Also, Greenwood, yes, is Greenwood and Walter Collington. So please reach out to me. I'd love to get some information to you. Prostate Zero is another resource that has a lot of tools on their website that you can download. But I'd like to do some more work in that area. So if you'd like to reach out to me, my information is on here. And we'd like to figure out ways that we can get more information and education to the Greenwood area or anywhere that you see that's in the dark green.
Excellent. Well, I wanted to say a big thank you to our guest speakers, Nicole and Tyrone, for your leadership, your determination, your dedication, and for giving us your time. Let's give them a strong MNCHWA thank you, for being here. If I could, let's open up the room for if in the chat, put some key takeaways that you might have gotten from this session. Maybe any questions. Feel free to unmute, but please in the chat write some key takeaways that you got from this. Any questions you might have. And if those questions aren't enough to prompt you, these sessions, we want them to be applicable to you and your professional development. So we hope this session gave you some tidbits, some things you could walk away with to help you have these conversations and feel equipped to talk about this and approach these topics. But if there's other topics that you would like these meetings to cover, please put it in the chat. I will do my best to find experts such as Nicole and Tyrone here to speak on these subjects to inform the community health worker workforce and elevate and bring forth men's health, right? So that's the whole purpose of these meetings. So thank you. Any questions, any final thoughts, comments? Tyrone, Nicole, you want to share?
All right. I see some questions, so I want to answer them. Okay. I want to see what are the places in Greenville. We work in Greenville. You can feel free to reach out to us, Tyrone, myself. We can let you know who we're partnering with, who we work with, who are strong in the community to make sure we connect you. Tyrone's got his number on there. And Echols at sccancer.org. Go on our Facebook page, like it, share it, see where we are, see what we're doing, see what events. Let us know too where we could be and where we could show up for you. Where if you're having events or community engagement, other states. Now this is big for people in other states. Each state has a cancer plan. South Carolina, we are responsible for a cancer plan. So in other states, I'd recommend for you to go onto your health department website and see who is responsible for your statewide cancer plan and engage them in that way. All 50, and I've researched and I've looked at like 20 of them, but that is a way for you to figure out what they're doing, what the mortality rates are, what their plans are, and I know that they always want the community and community health workers and patients and everyone to be involved in creation of that plan to really reduce the numbers of cancer. What did you say? Was that Kevin? I can't read that.
He's promoting his organization. Keep
Yes.
counting on prostate.
Yes.
Absolutely.
Well, yes, please do. And share. I mean, There's a lot of things that we do that we have borrowed from other states and other organizations. So there is no need for us to, if something works and it's evidence-based and it's factually sound, for us to, we'll share whatever it is that we have. And we'd love to hear what else you all are doing or things that have been wildly successful in the states that you live in. We want, we're all in this support to keep the people and the humans that we love alive. So please share with us and let me know and if you see a best practice you think we could adopt in South Carolina, or you see something that we're doing that we can share. I have no problem speaking to other people or sharing information, but please get involved with your health department's cancer plan.
And I just want to end it with thank you for the invite. Again, give us a chance to talk more about South Carolina Cancer Alliance, because again, as you see, we'll talk all day because again, we're so passionate about getting that message out to making sure that people are getting screened. I know we just talk on one screenable cancer, but again, there was 4 more. But again, we were just talking strongly about the prostate cancer screening. So.
Excellent. Well, once again, thank you so much, SC Cancer Alliance, for being here, sharing this information. We are taking December off for, the holiday scheduling, everything like that. So remember to every third Thursday at 3 Eastern time are the MNCHWA meetings. So starting back up in January. And please reach out, connect with us. Let us know what topics you want this to be covering, and we will do our best. Or if you want to present a topic, right? You are experts as well. So we welcome that. Please reach out to me. I'll put my email in the chat. And if nothing else, you guys are free to go. And thank you so much. And have a great rest of your day.
All right. Everybody take care.
Thank you. Bye, y'all.